Hello, everyone, and welcome to the Down Syndrome Center of Western Pennsylvania podcast. I'm your host, Dr. Kishore Balodi, and today we are joined by, this is your third time on the podcast, so I think you are now friend of the podcast, Dr. Nicole Baumer, coming to us from Boston, and I'll have her introduce herself here in just a moment. But today we wanted to talk about a very specific neurologic issue that we can see, especially in infants with Down syndrome, called infantile spasms. And I know that many of the listeners to this podcast, you may have had your child who may have experienced these before, or you've certainly wondered perhaps about them, and maybe even sent us videos of your child having different movements, wondering if they could be these things. So I think it'd be really great for us to do a podcast that discusses this. But before we get into the podcast too far, Nikki, I was hoping you might be able to give us an introduction, who you are, what you do, why you love people with Down syndrome.
Absolutely. Hi, and thank you so much for having me back.
Yes, thanks for being here.
I'm really excited to be here again. I am a pediatric neurologist and neurodevelopmental disability specialist and director of the Down syndrome program at Boston Children's Hospital. So I'm really excited to talk about infantile spasms because it's really sort of a melding of all of my worlds. Yes, I absolutely love people with Down syndrome. I have a sister with Down syndrome who has inspired my career path and basically all aspects of my life. So I am really happy to be here today.
I love it. And I love the steady train of siblings that I like to have on the podcast. So great to have you as part of that. But Brian Scotko's been on with me. So it's great to have fellow siblings who have been so positively impacted by Down syndrome. So wonderful. So I guess to kick this podcast off, why don't you tell us, what are infantile spasms? Perhaps people listening may have never heard of them before. What are they? How common are they? Things like that.
Yeah, absolutely. I do think that infantile spasms is one of the conditions that seems to be under-recognized in people with Down syndrome. So I'm really happy to have the opportunity to talk with everyone today. So infantile spasms are a specific type of seizure that occur in babies. And what a seizure is really a sudden burst of electrical activity that occurs in the brain that can cause an abnormal movement or behavior or a certain feeling in the body. And just for a little bit of terminology here, so epilepsy is the term we use to describe repeated or unprovoked seizures, and people that have a propensity for more seizures have epilepsy. So infantile spasms is actually one of the more common and serious types of epilepsy that can occur in babies. And babies with Down syndrome are at a higher risk for this particular type of seizure disorder or epilepsy. It is still pretty rare, but can occur probably in about 2 to 5% of babies with Down syndrome, maybe a little bit more. But it can be very serious. So it is really important that the Down syndrome community knows about infantile spasms.
And what do they look like? Because I can tell you one of the things that this modern era has really offered us the opportunity is to actually see these spells happening and know that, whoa, those are actually more like infantile spasms. But so what do they look like? What are the characteristics that the families should be looking for?
Yeah, so this is actually a circumstance where videos can be really helpful.
Yes.
So it's a little bit more difficult to describe in a podcast, but I do encourage people to actually look at this on videos. There's lots of videos that are available on YouTube, and you can Google infantile spasm videos and look at this. But what they really look like are sudden and fast stiffening and bending of the body. So the baby's back or trunk may bend forward or backward very suddenly. And a lot of times the arms and legs will stiffen and jut out as well. And what's sort of characteristic about infantile spasms is that these sudden movements occur really in a repeated cluster. So several times in a row, every 5 or 10 seconds. And they can occur, up to 100 times a day or more. And they can look very small and quick, like a baby might move just if they're startled by a loud sound or something like that. But what's specific about infantile spasms is that these are not provoked by a loud sound or something that scares the baby. And the baby can also have sort of like a decreased visual alertness or be very fussy when these spasms occur. So parents should definitely look out for that. But the other thing that parents may also look out for or notice are developmental concerns that can go along with infantile spasms. So often with infantile spasms, there starts to be a lack of developmental gains or a developmental plateau, or even sometimes, if it goes on long enough, a loss of skills that were previously acquired, so developmental regression. And this can involve, motor skills like decreased head control or decreased tone. It can be a change in the communication skills. So they may notice that their baby stopped babbling as much, or even some of the social skills, like seeing that their baby is maybe smiling less or having less eye contact and seeming more socially withdrawn. So sometimes it's actually the developmental concerns rather than the movements that prompt families to seek evaluation.
Yeah, I think I've definitely seen that as well. And, as you're talking about how a picture kind of speaks 1,000 words, I think one of the things that we can do together after we record this is maybe try to find a nice YouTube video that we could share. I can put in the link underneath in the show notes. And I think that might be a nice way for families to see what these look like. I can tell you from the videos that we've received that sometimes I look at them and I say, oh, wow. Yeah, that's infantile spasms. We need to do the next steps, which we'll talk about shortly. And other times it's other things. And so what are some of those other things that you have noticed people think maybe it could be infantile spasms, but they actually end up not being that?
Yeah, absolutely. That's a great question. And I also really like when people send videos. It really can help sort of lead me in one direction or another when I'm reviewing these things, but can be very difficult to tell even when you're watching the movements. Because not all funny movements are seizures. And in fact, most funny movements probably aren't. There's other things like reflux or pain or constipation, or, babies can just do funny things and can have repetitive mannerisms. So I think it's really important to send videos to your care provider because that can really help tease it out. But sometimes you really just can't tell and need to do further tests to figure it out. So that's really important. But also, because the movements can also be really subtle and can be missed for a long time, especially in babies with Down syndrome, it's really important to be vigilant and to have any of these concerns evaluated.
So if the family has a concern and they perhaps if they happen to, see a Down syndrome clinic provider that can quickly review a video, or maybe they come to the ER and they bring hopefully a video on their camera that they can show. And there's a concern that these are truly infantile spasms. What are the next steps in terms of how they're diagnosed?
Yeah, so usually the first thing is that a neurologist will get involved. So, hopefully a pediatric neurologist, and they're going to want to know a lot of information about the child, what the movements look like, and also a lot about the child's development. And they'll review those videos, which can be very helpful. But really, ultimately, the diagnosis of infantile spasms is made with a test called an electroencephalogram, or an EEG, which is a test that involves putting a lot of little sticky electrodes on the head and measuring the electrical activity of the brain. And if the baby has infantile spasms, the EEG will show a very characteristic disorganized pattern of brain waves that we call hypsarrhythmia. And this is the finding that really would confirm the diagnosis of infantile spasms. Sometimes if it's really early in the course of the spasms, we don't see this pattern unless the baby is sleeping. So I always, if somebody calls me on the phone and tells me they're worried about this and I'm sending them to the emergency room, I always say, try to make sure that the EEG does capture the baby's sleep so that we can really see that if it's occurring. And also sometimes if the actual spasm movements are captured on the EEG, there will be a specific brain change that we see from that as well. So it's the EEG that really confirms the diagnosis, and the key finding we're looking for is hypsarrhythmia.
And then once that diagnosis is made, treatment, I'm assuming we would want to start immediately. And what does that treatment look like for babies with infantile spasms?
Yes, absolutely. And that is the key point, that we really want to treat infantile spasms as soon as possible. And immediately is the good word to use. The thing about infantile spasms is that it's different than other seizures and doesn't really respond to most of the seizure or epilepsy medications that we usually use to treat other kinds of seizures. So most of the time, the treatments that are used are really specific for infantile spasms. And the most common and preferred treatment is actually a hormonal steroid treatment that we call ACTH, or adrenocorticotropic hormone. And this is the first line therapy for infantile spasms. It's a treatment that's given by injection into the muscle every day, usually for about 4 to 6 weeks or so, sometimes longer. And usually the first doses are actually given in the hospital so that the child can be watched really closely for side effects. But the goal of this treatment is to completely stop the infantile spasms as quickly as possible and to improve that abnormal EEG. In some cases, under certain circumstances, there are some other treatments that may be recommended instead, like there's a medication called vigabatrin that's also used. But the neurologist will discuss the different treatment options and what's specifically recommended for a particular child. There's even some dietary treatments that are sometimes recommended. But I will say that for most babies with Down syndrome, ACTH would definitely be the preferred first choice medicine.
And how do they respond? Is it something that we see a difference in the way that babies with Down syndrome respond to the treatment compared to other babies?
Yeah, so for many, the seizures will stop really quickly after ACTH treatment is initiated. So usually within the first 2 weeks of treatment. And that is the goal. The goal is to just completely stop the infantile spasms as soon as possible and to normalize or have that hypsarrhythmia resolve. For some babies with Down syndrome, the infantile spasms will stop right away. But for some, there will be a return of seizures even after treatment. So we call that a relapse. And less commonly, the seizures can evolve into an epilepsy syndrome that's known as Lennox-Gastaut syndrome, which is a type of epilepsy that has lots of different seizure types and is much more difficult to treat with seizure medicines. But fortunately, most children with Down syndrome who have infantile spasms do seem to respond really well to treatment and seem to be less likely than those without Down syndrome to relapse or to develop this severe epilepsy syndrome.
So it's added then to our list of things that we often talk about when we get together, all of us who work with people with Down syndrome. There are certain things that for some reason on the 21st chromosome, the people with Down syndrome seem to do better. And I, from what I'm understanding, it sounds like with the treatment for infantile spasms, it is one of those times where it seems like, boy, they do seem to improve more regularly than perhaps other kids would with the same treatment. Are there long-term outcomes or developmental concerns after infantile spasms?
Well, so yes, that is the thing. And I agree. I think that most of the research does seem to point to babies with Down syndrome having better seizure outcomes than other babies without Down syndrome who also get infantile spasms. But infantile spasms, it's been described as little seizures with big consequences. So the long-term developmental concerns are one of the biggest problems that we face with infantile spasms. And so, even with really good appropriate treatment and good seizure control, infantile spasms can have a detrimental effect on development. It's been associated with developmental delays, with cognitive impairment, and even a higher risk of autism spectrum disorder. It's a little bit harder in children with Down syndrome to really know for sure what the neurodevelopmental impact is of infantile spasms because, children with Down syndrome already have pre-existing developmental delays, and there's such a wide range of, cognitive, language, and social abilities in people with Down syndrome. So it's really hard to know exactly what that neurodevelopmental impact is from infantile spasms. I will say that it's generally believed that children with Down syndrome do have a better response to treatment and better neurodevelopmental outcomes than other children with infantile spasms.
And I wonder if you've seen the same thing as I've seen, Nikki, where if the families recognize it quickly and they bring it to our attention quickly, we can start the treatment fast. If they respond wonderfully to that ACTH treatment, it almost seems like the faster things move, the better the kids do. Is that something you've seen as well?
That's absolutely something I've seen. It's even something that's been, tried to be looked at closely in the literature. I think that the best that we have with regards to the factors that can influence neurodevelopmental outcomes is how quickly we can recognize the infantile spasms, get them evaluated, and start treatment. I think that, what we've seen is that when a baby comes in for evaluation, after a prolonged period of time that the movements have been going on, or even after a significant amount of developmental regression already, those children tend to really have more of an impact on their neurodevelopment than the children where we can recognize it really quickly and start treatment really quickly. That's not always the case. It isn't always completely possible to predict how well somebody will respond to treatment and how they will do neurodevelopmentally. But I think trying to minimize that treatment lag is probably one of the best things that we can do.
That's great. So are there any other take-home recommendations or tips that you would give, on this really fascinating topic and such an important topic for us to cover on this podcast? Any other things that you would want to bring up before we would close the podcast?
Yeah, well, I guess so. I think that really, awareness and diligence. So I think that the first thing is doing exactly what we're doing here today, which is just trying to make people more aware of infantile spasms and the increased risk in babies with Down syndrome. And since that treatment lag may be, a modifiable factor in influencing outcomes, and maybe even something that's a little bit harder in babies with Down syndrome to recognize, I think that we just need to be doing everything that we can to provide that outreach and education and to let, families know that this is something to look for, even though it's really rare. So that's one thing. I guess the second thing is, for us to just be so vigilant about this. While there are many alternative potential causes of abnormal movements or even some of the developmental concerns that we see in Down syndrome, being vigilant for any symptoms suggestive of infantile spasms should really prompt a very quick and thorough investigation. And then I guess the third thing I would say is that it's really important for people to provide first-line treatments for infantile spasms for babies with Down syndrome. So most of the time that really should be ACTH. And I think that there can be some hesitation. People might worry about some of the side effects of ACTH, like increased risk of infections or even just the difficulty of giving the injections. But it's really important for babies with Down syndrome to have that early appropriate treatment. And really closely monitoring development and doing regular developmental and educational assessments can be really helpful, especially for babies with Down syndrome who do have infantile spasms, because they will really need to have intensive developmental therapies in order to support their developmental progress. And I hope that too will help to improve overall neurodevelopmental outcomes. So I guess to sum it all up, increasing awareness, being really vigilant for infantile spasms, and making sure that babies with Down syndrome also get first-line treatment and close developmental monitoring and therapies would be, the take-home messages that I would hope everyone would get.
Yeah, and for our local families here, and I'm sure, Nikki, for your families as well that you follow in the clinic there in Boston, if you have concerns for these types of movements in your baby, by all means, please do reach out to us. We love to get the videos, even if they're not looking like infantile spasms. It's always wonderful to get cute videos of babies, and so feel free to please send those to us, because it can be completely life-saving, life-changing if we can get these things treated and managed quickly. So thank you so much, Nikki, for joining us again on the podcast. I really appreciate you sharing your expertise with us again today.
Thank you. And thank you for having me.
Yeah. And for our listeners, if there are topics that you would like us to cover further on this podcast, please do reach out to us. We love getting those emails that helps point me in the right directions of things that we need to be talking about. So you would just send us an email to downsyndromecenter@chp.edu, and we will be glad to find speakers that can talk about this from their training background as well. So until next time, bye-bye.